The wife of a terminally ill cancer patient says the government has failed her husband and many others by not having an adequate cancer plan. Melissa Vining was speaking at a cancer conference in Wellington where she addressed fatal flaws in our public health system. Our health correspondent Karen Brown reports.
Melissa Vining's husband was diagnosed with bowel cancer in October last year. He was told it was terminal with no options for treatment. She fought back tears as she recounted what her family has been through.
The prognosis for stage 4 cancer that is spread to all segments of your liver doesn't get cured. No surgery, no cutting out of pieces of his liver, not able to give him my liver, no immunotherapy, wonder drugs, no cure.
Mrs Vining told the conference that she once made 19 phone calls to seek urgent help when her husband was at his lowest ebb. He also had to wait 13 hours to be flown from Invercargill to Christchurch for emergency surgery. She thanked the Health Minister David Clark for coming, then added,
"However, you have failed Blair, you have failed me and my children, and you have failed many other New Zealanders by not having a cancer plan."
Melissa's husband, Blair Vining, is a former Midlands rugby player and coach. He says he doesn't want sympathy for his cancer diagnosis.
Don't feel sorry for me, don't pity me, but don't think that you are too young or too old to get cancer. Cancer doesn't care how old you are, cancer doesn't care how rich you are, cancer doesn't care how lucky in life you think you are.
He adds the health system is ill-equipped to deal with the numbers of people needing treatment for bowel cancer.
I was urgent. I got told I would be seen in 1 to 2 weeks. I received a letter in the mail saying 6 to 8 weeks is the true timeline because the Southland District Health Board is 6 to 8 weeks behind because there is the biggest bowel cancer backlog in the country.
The Cancer Society's medical director, Chris Jackson, said cancer control is suffering in New Zealand because of a lack of leadership. He says treatment for patients varies depending on where they live and their ethnic group, along with cultural and socio-economic factors. He also hinted at a lack of ownership of the problem.
Unfortunately, we invited every member of the Health Select Committee and Health spokesperson to any part of this meeting, including the opening in our own backyard, and we had responses from 2, the Minister and 1 other. That could potentially reflect part of the problem.
Health Minister David Clark said a plan is clearly needed and he's instructed the Ministry of Health to begin right away.
There is widespread agreement that we need stronger leadership of our cancer control. At the same time, the Ministry of Health has become better placed to provide the stronger stewardship and leadership of cancer prevention and control and delivery of better outcomes at the national level.
The head of the ministry, Ashley Bloomfield, says they're starting work on a plan this week, which will cover how patients access care locally, along with wider issues.
What we need to do nationally to determine specific standards of care, expectations, and to monitor the experience of people as they go through the system, to monitor their access to care, the process of care and the outcomes of care.
Dr Bloomfield intends to have an interim plan ready in late June. Mō te hōtaka o te ahi, ko Karen Brown aho.